We're doing a great combination treatment. Actually, I do this treatment now every 3 months. This is a combination of a device called Fractora, which is microneedling radio frequency, but it's deep microneedles. What it does when it goes into the skin is stimulates collagen production through microchannels of energy on needles. Each puncture sometimes leaves a little pinpoint bleeding, but that pinpoint bleeding is great because when we laser or we put topicals on top, it's going to allow more penetration of those products into the skin. What's great about this device is that this needle have two different types. They have coated and uncoated. The coated ones will be a little more protective of the epidermis and are really safe in darker skin types. The uncoated ones, which we're using here, are going to be great for his skin type because he's lighter skinned, and it's going to give him more tightening and more improvement in the overall texture of his skin. And a lot of people ask me, why do we do these combinations? A couple reasons. One is we want to get more improvement in a single treatment. Two is we're hitting different levels of the skin at once. So we really want to give him that improvement in the surface, and you won't do that as much with the microneedling radio frequency, but you'll do that more with laser. So if we do a superficial laser with a deep microneedling, you can get just an amazing improvement with not as much downtime. So we are on part 2 of our full facial rejuvenation plan. Now we're on the surface. To give you a perspective, this is about 200 to 300 microns, which is about 0.3 millimeters. So all the sun damage and all of the pores and discoloration, especially precancer cells, pigmentation, fine lines, and crepey skin will be improved. That this is my go-to maintenance treatment. Fraxel is the only non-ablative laser that's ever been FDA approved for a cancerous condition, precancers and skin cancers. So for those with, like him, blonde hair, blue eyes that are very high risk for developing skin cancer over time and sun damage as they age, this is the treatment you should be doing every 3 or 4 months no matter what. That's number 1. Number 2 is you should be doing something stronger at least every 2-3 months to get exfoliation and peeling in your skin. And then we would tell him to maintain this in a few weeks to a month with the peel and kind of alternate those things so that we're really working at all levels on the skin. I think it's important for people to understand that to take care of your skin, it's a treatment plan. It's just like going to the gym. You can't expect to lose weight or be a bodybuilder if you go once every 3 months or 4 months. You got to make it consistent. We're now going to finish doing just a very light, very superficial erbium. What this is going to do in a machine gun-like fashion is just ablate the upper surface. This is going to make him peel the first couple days, even more than the Fraxel. The Fraxel goes deeper than this. So again, we're working our way from bottom to top. You can see the pulses across the skin. We only do 1 pass of this because the delivery of heat energy here is equivalent to actually a CO2, but it just needs that little superficial treatment. You can see the little fractional columns developing. This really helps with the thickness of his skin and scars. Going over the scar a little bit more. There's a couple areas of scars that we're treating a little more aggressively. And then lastly, always gotta treat the lips, you guys. It's very important. Helps with sun damage, and it will prevent him from getting skin cancers here. Now we are done with our laser treatment. He did really well.